Good morning, good afternoon, good evening from wherever you're joining us from. This is your host, Noah Ndlovu, broadcasting live from Premier Media Studios. I have a special program to share with you all, and we encourage you at this time, make sure you invite your friends, your colleagues, your cousins, your aunties, your uncles to tune in to be part of this conversation. We are looking at the healthcare, the state of healthcare in Zambia. Zambia is one of the countries located in the southern part of Africa, and the healthcare is such that it may need some adjustment, it may need some facelift. We see a lot of our educated or maybe highly paid people, officials, government folks. Each time when there's a sickness in the country, they depart to a foreign country for help. Now, what does that say to those who may not be financially steady to secure these trips and just the financial backing to be able to seek medical guidance in a foreign land? So joining me today, we'll look at the state of healthcare in Zambia, and there's much more that needs to be said. There's much more that needs to be done. But the focus of the conversation is not obviously on me. I am just here to facilitate the conversation. I have a team of distinguished people, and will be joined by others still trying to make their way to join us for this important conversation. But to start us out on this important conversation, we have Professor Molenga, Modest Molenga. He's an intellectual, and he's going to start us out and let us know. I think we will start with his background so that at least people who may not be familiar with this gentleman will have a good understanding of where he's coming from. So when we come back, Professor Molenga is going to be joining us. Now, joining us on the screen is Professor Modest Molenga. Professor Molenga, before we get going, just tell us a little bit about yourself so that people may have a good understanding of who you are and where you're coming from. Your background, sir.
Yes, thank you very much, and good afternoon, maybe good morning to other people in other places. As you heard, my name is Professor Modest Molenga. I'm currently the Deputy Vice Chancellor for Research and Innovation at the Lusaka Apex Medical University. As you can see from the screen, I was trained at UNZA, and thereafter worked in the government hospitals before I joined medical research. Over a short period of time, I went for training where I spent a lot of time in England, basically training in tropical medicine, clinical tropical medicine, and therefore embarked upon research, doing my master's there, doing my diplomas there, up to PhD. And currently I'm also a fellow of the Royal College of Physicians of London. I've worked as a researcher for a number of years, rising through the ranks until I became the director of the Tropical Disease Research Center. And within that portfolio, I was also the chairman of the Joint Coordinating Board of the WHO Special Program for Research and Training in Tropical Diseases. I'm currently one of the advisors to the regional director of the WHO Afro. And basically, that is my background. I've done a lot of research, my own creation, having a number of portfolios in research, particularly in infectious disease and tropical medicine. I've done a lot of work on malaria, that work that has transformed the way we treat malaria in the country. I've also done nutrition work, HIV, and other neglected tropical diseases. I think in the background, I'll say that's what I can say. I worked at CBU before I came to LAMU, also having worked with the USAID. I think basically in a nutshell, that will give the background of what I've been able to do.
Yeah, thank you, Professor, for starting us out. And now we're going to transition to the other gentleman. He's from the entrepreneur side of things. We're going to bring up Mr. Manso Chalo to give us his background, and then we'll get going. So now, Mr. Chalo, a little bit about yourself, sir.
Yeah, thank you. Thank you so much. Nora. It's a great pleasure to be here. Thank you for the opportunity to come through and discuss a very important topic at hand, which is healthcare in Zambia and by extension in Africa. My name is Chalo, as hinted. I am founder and CEO of a healthcare startup called Junior Healthcare. My background is in economics. I studied economics at the Coca-Cola University. And after my time at the university, I went into entrepreneurship full time, started a cleaning services business at the time, ran it for about 7 to 8 years, and then transitioned into what we're doing now at Dunia Healthcare, which is pharmaceutical logistics. And a few people might ask, what is an economist doing in healthcare? I come from a background of a family that has been running healthcare businesses for the past 30 years. My mother, who's a retired nurse now, had owned her own private practice back home in Kalushi. Later on, owned a network of retail pharmacies as well. So growing up, I've always been around the healthcare space, understanding fully well some of the difficulties and struggles by helping my mother run her different businesses. So it was a bit of a natural progression for me to look at the opportunities that were in the market at the time and what solutions we could provide, which I'm sure we will be able to talk about as the discussion goes on. But in a nutshell, that's Mansa Chalo, and yeah, that's what we do.
Yeah. Thank you, sir. Yeah, so for those who are just joining us, we are having an important conversation with two gentlemen who are looking at the state of healthcare in our beloved country of Zambia. So we're going to go ahead to some formal questions now so that at least people can, if you have questions at any time, feel free to put it in the chat and we'll get going from there. Feel free to bring your questions because we as Zambians, we are all interested in saying that the state of healthcare in our country is what we want it to be. So stay tuned. Yeah, so Professor Malenga, what is the role of research? What does research and evidence, what is the role of research from your perspective? How does it play into what we are seeing? Based on your experience, obviously you are coming from the area of research. What is the state, let me just put it in simple terms, what is the state of research in healthcare in Zambia?
Yes, thank you very much for that question. As we speak now, the research base in the country, we've seen it expand tremendously compared to the days we had in the 80s or 90s when we just had very few researchers. Now that research has been expanded both in academia and even in practice, you find that it's now happening luckily everywhere, and there is a tremendous amount of evidence that is being generated to influence the way the best practices in medical care, in healthcare. The role of research and evidence generation is very, very paramount and very important in the practice of modern medicine. As you know, in modern medicine or conventional medicine, we don't do things by chance. Everything that is done has been researched, or if something shows some promise, there must be some research done to make sure that it is proved or disproved. Therefore, research is what drives policy formulation in healthcare, both for generation of products, medical products, as well as generation of information that will improve or modify the way we provide healthcare to the people in different places and to different age groups, including gender provisions. As you know, diseases in one group of people in one area, they present very differently from another group in a different area. That's where we now gather evidence that actually gives us information about how to provide healthcare according to people's setups. So in the Zambian scenario, a lot of what is driving our health strategies is actually based on research.
Yeah, thank you, sir. Yeah, research is usually, obviously, it's key because it's from research that new information is gathered and then innovation takes hold. So I think let's push us back now into the next panelist, Mr. Charlo, who is an economist. Let's hear from Mr. Charlo, and then we'll circle back to Mr. Mulenga. So, Mr. Charlo, you as an entrepreneur who is an economist, can you briefly share your innovation and how it addresses specific gaps in the healthcare in Zambia?
Yeah, sure. So junior healthcare operates at the intersection of technology. We're a digital first company, technology, pharmaceuticals, and logistics. So we're right at the intersection of those three things. And we're trying to solve the problem of access to medicine in Africa. You may be aware that about 3.5 million Africans die annually because of lack of access to medication. And the problem of access itself can be broken down into two main problems, which is the first one is the problem of availability. And you're asking yourselves whether medicines are available in the facilities, whichever dispensing facility that is, whether it's a hospital or a retail pharmacies, are medicines available for the patients that need the medicine? So that's the first one. Then the second one is around affordability. If the medicines are available, are they affordable for the people that would like to get the medicines for whatever diseases that they may have? And so those are the two interesting problems that we're currently, that feed into the larger, bigger problem of the deaths that are stemming from the inavailability and unaffordability of medicine in Africa. And basically that's what we're trying to solve using the technology that we have. And what we're doing currently is we've built a B2B marketplace that connects retail pharmacies and health facilities to pharmaceutical wholesalers and manufacturers. So hospitals, retail pharmacies are able to order medicine for their pharmacy on our platform, and we are able to deliver to their doorstep for free. Currently, we also have a distribution network in rural areas through a partnership that we've done with the Zambia Conference of Catholic Bishops. The Catholics have 75 mission hospitals across the country, largely in rural areas. They struggled a lot with distribution of medicines, as you can imagine, in most of those facilities. In some cases, you find that medicines would be ordered but would not be delivered a month plus, which means that a lot of the patients that we have in those rural areas would not have access to medication. And basically, one of the biggest problems you find in rural areas is that you have small pockets of demand that are spread across a large geographic space, which does not make it commercially viable for wholesalers to set up shop in the rural areas, which is a big problem, right? With the platform that we've developed for the rural areas, we're able to aggregate the small pockets of demand that is in the rural areas and aggregate it into one bulk order, which is then sent to the wholesalers that bid for those for the bulk order, and then we do the underlying logistics to distribute to the facilities in those rural areas. So those are the two main things that we're doing as far as distribution of medicine is concerned.
Country for quite some time. So the question that I have, I think it's always good to see different folks from different sectors of the country, because when you have people coming from different parts, and they bring in different skill sets, and it's always good to see that, because when we see that, that is something that enhances the overall quality of healthcare in the country. So here is a question for Dr. Lon. How is the private sector integrating health innovations such as telemedicine or digital records into its service delivery?
Yes, thank you for your question. Now we are knowing that new technique is very quickly developing in the world. Now the telemedicine is one of using for the medical service. For example, like 1 month ago, we are creating this telemedicine chance between China and Africa. The 5-year hospital is also help this procedures. We are creating the website education for the radiology technology. Majority program the teaching by China, from China, about the some new technology in the radiology, some how to operating the machines, and also how to deal with some special case, even the local more common case. Yeah, this online training program, we are total 2 weeks. One day is 2 hours. So many Zambia workers who is working in the radiology, is like some other clinical doctors, they take part in this training. Yeah. So this we just the first time to join these procedures, and have the good response and good results. Thank you.
Here is another question, Dr. Lon. What opportunities exist for collaboration with the public sector or tech innovators in your area of specialty?
Okay. For the medical service, like you mentioned, the advanced machine is playing a very important role for the medical practice. So in the world, is the medical machine also development quickly. Like you mentioned, the big machine, the MRI, CT, like DSA, cath lab, even some traditional X-ray. Now we have the DR, and for the mammogram, this machine also more modern. Some ultrasound scan. Now we have like a 4D, and also some special heart ultrasound scan, even for the kind of practice, the machine specialist. So like our hospital, like the private hospital, the investors invest much more money to purchase the new machine. Like now, the new machine, like 1.5 Tesla MRI is already in fixing procedures. The other more modern CT, we call 512 slices. This machine, even in China, is very advanced. So far, we noticed this is the first one in Zambia, and I think it's also even the South Africa, the other country in America. I think this is the leader one CT machine. They can, especially they have the special function to do CT scan heart without any like DSA some operation something. We just can check the coronary artery use this machine to compare with DSA. It's very helpful for to heart disease. So also we are already ordered. Already the machine is on the way to come, like the cath lab machine. Yeah. So I think the investment is very important to follow with new technology, like the new machine. If no chance to get the money, and also we have lost a chance to get the more modern machine. So for the private hospital, I think for the make this decision is more easy by the company. So can like to a fast decision and quickly activity. So this can help the Zambia people to get the new medical service to save more of the life. Yeah, I think this is very important, the investment, and we follow with the advanced technique in the world. Yeah, this is our task.
Yeah, that's true. That's true. It's important to have this type of innovations and obviously experts from different sectors coming. I've seen a lot of advancement. It's just amazing the level of advancement that we see in China in terms of medical devices and equipment. In my opinion, I think China is pretty much well up there. Obviously, the United States, it has a lot of innovations, but China and these other Asian countries, I mean, Japan, Korea, they are pretty doing much better. So we hope Zambia in future will be able to get our country where we think that at least we can compete with the rest of the world. So now we're going to circle back to Professor Mulenga, Mr. Professor Mulenga, and talk a little bit about the successes. Because as we are doing everything in the area of research, there's always the need to gauge the level of success. Are there successful examples of research translation into scalable health solutions in Zambia, Professor? Oh, yeah, so you are muted. Make sure your mic is good, Professor.
So, sorry about that. Certainly, there are numerous examples that we can cite as some of the success stories of research in the country. It's always important to remember that the vast majority of our people, they still live in rural areas where access to healthcare is extremely difficult. We can be talking about towns provide this and that, but out there, people really need a lot of quality healthcare. And for those people, it's always better to prevent those diseases before things escalate. Let me give you an example of the research that we unveiled some time back about the blindness that was taking place in the Luapula province. It was generally known that the blindness that was occurring in Luapula province was due to river blindness, which is basically blindness caused by a worm and the disease is called onchocerciasis. This disease actually occurs in places where there are fast-running rivers, because the insects and the worms that cause the blindness, they coexisted. But the research that was done by our institution in that area proved that that blindness was actually not due to that parasite, but it was due to vitamin A deficiency. Simple as all that. Vitamin A deficiency was occurring because of malnutrition in the area. So when we did research to find out what the cause was, it was now imperative on the government to institute vitamin A supplementation in that area. Further research actually revealed that vitamin A deficiency was a very big problem throughout the country. Therefore, the Ministry of Health started scaling up the provision of vitamin A supplementation to all children throughout the country. And the results have been very tremendous. That problem of blindness due to nutritional deficiency arising from vitamin A deficiency has now been reduced to virtually zero. By doing simple research, that discovered a problem like that. And that also unveiled the problem of other micronutrient deficiencies that were occurring in many parts of the country, and those are now being addressed through nutritional programs. I can also give examples that in the area that I worked very much in, malaria, the drugs that we are using at the moment, it's the research that we did in this country that gave us evidence that these were very good medicines. And from the time these new medicines were introduced, we haven't even seen resistance. And these medicines, we make sure that they are easy to take. They can be taken by a large group of people, from children to pregnant women, and they can be taken for a short period of time and remain effective for a very long period of time. That's also very unprecedented. Other colleagues have also done work that has transformed the way we treat HIV in the country, because the HIV treatment in the country has been tailored to the research findings that have been very specific to Zambia, including looking at people who are likely to stay on treatment for a long time. Voluntary male circumcision, for example, is one of those things that occurred like that, and many other examples that I can actually cite. So indeed, research also transforms the way we provide medical practice. Right now, we are talking about non-communicable diseases, things like diabetes that are on the increase, things like hypertension. And the hypertension is killing a lot of people, even more silent than people actually thought. We did some research in which we tried to find out the death rate has become very high in the country. We wanted to find out which age groups constitute people who die outside the hospital. To my surprise, I found that with a group that we worked with, through research, we found out that the people between 20 and 50 years, males, were in the majority. So you can imagine if we didn't know all that, and this is an age group of people who are supposed to be highly productive. But apparently that's why we are finding a lot of young people dying. So the life expectancy in the country also needs to be studied so that we understand how to provide health care before diseases actually develop. Because that way, it will even be cheaper to prevent complications of diseases that are diagnosed early. And the provision of health care before diseases occur needs to be improved in the country. And that requires a lot of research and innovation. Because, for example, the healthcare system we have in the country is telling us that it's very passive. It's not active. What do I mean by that? The healthcare system in Zambia waits for the patient to go there. in other countries, they have demography of people living in a particular area, and the doctor is mandated to make sure that he caters for the people living in his area. If you reach certain age groups where you are vulnerable to particular diseases, you are automatically called. And because of the digital technology that has come, people have got database, and a message will come on your phone that you are required to go for medical checkups. And in some situations, they're even making it a law that if you are unable to go through these early medical checkups, when you go for definitive treatment, you are likely to incur a lot of costs because you've been negligent. All these things are being informed by research and application of new technologies. Thank you very much.
Yeah, I think that's well said, sir, because I think technology is key, especially in technology, obvious, which is informed by research, is very cardinal, because when you do the research, you are able to identify. For instance, even me, when I was coming up, I used to think the people up in the northern parts, the blindness was due to the fish. So it's good information. Thank you for sharing and doing the research, because I equally thought the same. So now here's a follow-up question, Professor. Now,
Yes.
how can academic institutions better collaborate with the startups and the government to drive innovation?
Yes, as you know, the institutions that we have that are basically academic,
Mm-hmm.
I would maybe group our services into three. One is provision of education. Number two is provision of healthcare, because the people working in our institutions are themselves doctors, nurses, and so on. So we encourage those people to also practice their trade in providing healthcare. Then there is also a component of continuous research. So provision of teaching, healthcare, and research, they go together. These issues of, even in teaching, there are a lot of innovations that have come in, especially during the time of COVID. We learned a lot that people crowding in a classroom wasn't the way to go. So teaching now was occurring more online. And now people have innovated tremendously that sometimes people can even sit for exams basically online. And a lot of teaching can also happen online. A doctor can be demonstrating in a hospital. Students from different places can be following what he's trying to do, and they'll be able to practice with everybody out there. And the modern way of teaching, even teaching studios have come up, demonstrations with in medical skills. Now, because of the large numbers of students, we are even using simulators. That is, mannequins, these dolls that represent human beings. Because of technology, they've been made in such a way that they can even complain. They can even, when you prick, they will show that they are feeling pain. They've all been produced using modern technology and with artificial intelligence. That is on the teaching side. Innovation is also coming in the provision of healthcare. Like Dr. Luan has actually said, the diagnostics that we are now using are so much improved that sometimes, scanning can be done in one part of the world, diagnosis is made in another part of the world, and information is exchanged in no time at all. Or basically, the machines that we're now using themselves can actually suggest a diagnosis just as you are probing things. Nowadays, you can take a blood sample, put it in a machine, it will give you a lot of tests to show the status of health of an individual. So we've got that in healthcare as well. And you're now even hearing that innovation is coming in, where a doctor, maybe situated in China, can actually conduct an operation in a place like Zambia, using artificial intelligence and moving machines just by remote. So many things are happening. And even in some of the innovations we are working on is to see how we can begin to translate these complicated medical terms for our people in hard to reach places to be able to share information. We are also trying to innovate how our people can actually reach a doctor for advice in their own language with simultaneous interpretation so that the two can communicate or a group of doctors can communicate. So information can be shared in a very short period of time and a patient can be assisted. Although, of course, the problem we are facing at the moment, digital penetration in rural areas is still a problem. Not so many people are owning smartphones. So there will be need to innovate, like we've done in Rwanda, for example, have tailor-made digital gadgets that can be used for healthcare. Some are even using them for agriculture and many other things. Like we have now, the digital technology, the way it has penetrated the transfer of money, we also want it to be used for things like healthcare. And that is progressing, and we've got a lot of colleagues who've gone to telemedicine, and it's working very effectively. Thank you.
Yeah, thank you, sir. I think also there is just a lot of innovation that has come, especially from East Africa. For instance, there's money sending apps, and I think Kenya and other countries have done a better job. Rwanda is actually in the forefront in terms of cleanliness and ensuring that at least because when you're in an environment which is clean, it helps to prevent some diseases. But when we are in walking around in parts of Zambia, sometimes you see all kinds of things, especially rainy season is just around the corner and the drainages are not used for the purpose intended. So from a healthcare perspective, it's concerning because a lot needs to be done to ensure that at least the country, and it's just a lot of sensitization that some of these things need to be used for the purpose intended. But we're gonna take a short break, and then when we come back, we're gonna have Mr. Chalo Mwansa share some thoughts. So let's sit back, relax, and then Mr. Chalo Mwansa, you are up next, sir. Yeah, so Mr. Mwansa, you have been sitting there listening, and now we are throwing you up there to some questions. So I think here's a question for you. What significant barriers have you faced in piloting or scaling your innovations in Zambia?
Thank you, Nora. I think that's a good question, and I think it's a good follow-up to part of the conversation that Professor was having with you around some of the issues that we have in healthcare. And I'll start from where he ended, right? Because that's one of the key barriers that we have, which is connectivity issues, especially in the rural areas. I'll be quick to point out that 60% of Zambia and Africa by extension are all in rural areas, but connectivity is quite hard. And so when you're trying to innovate in the digital space, you have to be extra creative for you to actually be able to pilot and scale your product into the rural areas. That's definitely one of the big issues that we've had, which also speaks to a second point around adoption of technology as well. That's a difficult problem to solve, because I think a lot, when you are innovating in a country like ours, you have to sort of teach people how to use, how to use different applications, different gadgets, and ABCD for them to actually start using whatever solution that you're trying to put out. So that's one of the barriers that you'll find. So like even right now, we've built a digital platform that connects retail pharmacies, hospitals to wholesalers and suppliers of pharmaceutical products. And we do the underlying logistics for that. But you find that because of that adoption of technology, which is, it's far better than it was 5 years ago or 10 years ago, but we still have a bit of a long way to go. You find that we have a bit of a hybrid model, whereas we have people that are using the online platform to make those orders, but we also do support them offline of that order. So those are the kind of realities that you get to find and barriers that you get to find as far as innovating is concerned. Maybe another one that I would touch on is around policies. Healthcare being healthcare, it's a highly regulated, industry on its own, as it should be, but then that in itself can sort of stifle innovation, especially if you have got strict red lines around what you can and cannot do. And so what gets to happen in the end is that you don't have a lot of people coming through to innovate. You find that the healthcare industry is lagging behind several other industries as far as innovation is concerned, partly because of the policies and the red tape that is there. And you could understand why the policies are there, but I think it is also important for the government to be in a place where they can, meet the innovators like ourselves midway, right? Because we also need to make sure that we're efficient with the resources that we have as a country, and we can only do that when we're being as innovative as possible. So I think that's one of the other things when you look at the difficult barriers that you get to find. From my own experience as well, healthcare has got a very high premium on trust. Whoever you're working with in healthcare, you would have to earn their trust, which is different from the other industries that most of the people, you're innovating and that I've worked in as well. You really have to build that trust between yourselves and the suppliers and the other players in the market for them to actually begin working with you. So that could be one of the barriers to entry, because a lot of the new people that would like to just come on, it takes time for them to actually build a portfolio of trust that they can leverage for them to bring in innovations that most of the market doesn't know about, but will be willing to jump on. So that's the other thing that has been a bit of a barrier when it comes to innovating in the space. Data is one of them as well. So one of the key issues, that when you are trying to innovate, is that you need a lot of data for you to actually build something that is of value to the market. But when you look at the healthcare industry, which is not just a Zambia problem or an Africa problem, it's a global problem. A lot of the data that is in healthcare, is quite sensitive data. But then you need policies that allow for anonymized data that is structured, that innovators like ourselves can also sort of tap into as far as innovation is concerned. So those are some of the barriers that I would say, sort of limit the innovation in Zambia as far as healthcare is concerned.
Be strong.
Here's a question for you. How do you collaborate with public institutions, healthcare workers, and the NGO?
That's a good question. And I think at the heart of what we do as Dunia Healthcare is we leverage a lot of partnerships for us to deliver the kind of outcomes that we'd like to have for patients in different areas across the country. And one of the partnerships that has been quite key to us building and scaling, the first one has been we partnered with the Zambia Conference of Catholic Bishops, which is a faith-based actor in the healthcare industry. As you know, a lot of the faith-based organizations have got mission hospitals in different rural areas. And because we wanted to help reduce the number of deaths that are caused by lack of access to medication, And you know that the biggest struggle in the supply chain of medication is largely in the rural areas. They were a premium partner as far as distribution of medication is concerned. So we partnered with the Catholic Church to digitize their procurement system and streamline how they do the distribution of medicines to their facilities. Just a little bit of a background around that. So before the partnership that we had with the Catholic Church, each one of their healthcare facilities would come to Lusaka on a monthly basis to procure medicine for their facilities. Some of them, like St. Paul's in Kashikishi, would travel 1,000 kilometers one way for them to just get their medication, which is highly inefficient and highly costly for the facilities. For some of them, it would cost them 35% of their budget just to sort out the logistics complication that comes with being in a rural area. But when we came along, we built a digital system for them, the partnership, and with that, they are now able to just plug in their orders from their rural areas, and then we aggregate those orders into one order. Then the different wholesalers get to bid for those orders, and then we get to do the underlying logistics to distribute to those facilities. So that's, I think, one of the big collaborations that has worked very, very well as far as distribution of medicine is concerned, and collaboration as well is concerned. So that's one part on the non-faith actors. I think on the part of the public institutions, we are still trying to figure out the different synergies that we have that the government can leverage actually, because our mission is to build the biggest distribution network for pharmaceutical products in this country, second only to the government. So part of what we aim to do is what are some of these efficiencies that the private sector has in the way that we're doing our distribution that the public sector can take a leaf from, so that then they can benefit from that. I'm sure most of you have been reading in the newspapers the past couple of weeks. There's been a huge laundry list of issues that have been coming up as far as supply chain for pharmaceutical products is concerned, and the inefficiencies that are there on the public space. So we have had a few conversations with the Ministry of Health at different levels in terms of what sort of collaborations could be done around that. But a lot of that work is still in the pipeline. We've also had collaborations with different NGOs, especially those that are in the healthcare space, around funding some of the work that we are currently doing. So it's a whole array of collaborations that need to work. And when we were getting into the healthcare space, one thing that most of the innovators will tell you is they usually leave out healthcare because they call it the wicked problem, which basically means that the problems are too big and too multifaceted, for most of the people to get in and try and solve. So if you're looking at actually getting the positive outcomes that you're looking at, a key part of working and innovating in healthcare is collaboration and partnership. So it's something that we take very, very seriously at local level in Zambia, but also at continental level, to look at the other innovators and what they're doing in East Africa and West
Africa. Dr. Lorna, question is how can private providers help bridge service delivery gaps in underserved areas?
Yes. So, for any new technology and also some new method service for the patient. The problem is we need to have enough the medical staff to understand, and then we can use some like education program, like you yourself, you are the media of the mass communication, so we can use many chance to let more people to know what's the help of some new techniques and some like new medicines, so can help some special patients. Yes.
Yeah. Thank you, Doctor. It's just important, I think, to bridging the gaps when it comes to different providers. I think the country is at the point where we need to focus on the areas where we have the underserved communities, especially in the rural areas. I think in the urban areas, there's a lot of medical units or spaces that have sprung up, but I think yes, the other areas, there's so much that needs to be done. So thank you for that. Let's go to Professor Mlenga. What is your final take-home message, looking at the state of?
Yes, thank you very much. And it's always nice to hear from people who are on the ground, sharing information. Of course, I would just want to say that we are in exciting times when where research is concerned, but we certainly need a lot of investment in research. Otherwise, without it, like you mentioned, we'll just be doing research that is just for papers. We want research that impact the way we do things, that improve the way we provide healthcare. As an academic institution, we want to see the industry can come to us because we are there for them. See and utilize the student potential that we have. As you know, we've got students at different levels, just coming in with BScs, students at master's level, and students who are doing PhD. They can actually work on complex issues. And as you know, technology is very much in use now. Most of our researchers are internationally trained, so we are fairly equipped. All we need is just to have these pieces of equipment to be able to work more effectively. And we need these equipments available, and their maintenance is very, very important, because in many cases we are failing because we bring in equipment, but we fail to maintain it and sustain its use for the benefit of the people. And at the same time, let's not forget that there are people out there in the periphery who actually need our services, sometimes even more than the people along the line of rail or in developed areas. They need our assistance. Where healthcare problems are immense, that's what we say. That's where research is needed, and that's where resources for research are not available. So you have to think about that all the time, that the marginalized are really marginalized, but they need our attention. Thank you very much.
Yeah, that's well said, Professor. Well said. The marginalized need our attention. So now let's go to Mr. Mwanso Chalo. Your final word, what you would like our listeners to take away.
Yeah, thank you. I think healthcare has got many problems, and most people, especially innovators, would rather shy away from healthcare because of the many problems that are there. But I think that shouldn't be the way. I think we need to make sure that we get our best and brightest minds to get into healthcare and solve the many problems that we have, because you cannot develop a country, you cannot develop a continent if the population is unhealthy, if people are dying needlessly and senselessly. That's a lot of resource that we'll be losing out. So I think priority number one, as far as distribution of resources, in as much as intellectual resources concerned, in as far as capacity is concerned, priority number one should be healthcare. And I think that's where most of us should be getting into, because the problems that we have are agent. They're difficult, but they are agent, because this leads to deaths. And it's important that, like Professor had said, we also include people that are in the rural areas. A lot of the things that we are working at now are designed for the urban areas. But there's just 40% of us that are living in these urban areas. The majority of our people are largely in the rural areas. So we need to make sure that even those are targeted for us to be able to improve the outcomes for patients in Zambia and in Africa. I believe it can be done. I believe if we put our minds together, if we can collaborate at different levels with the government as well coming on, I think it would be great if we can work and see how best we can save our people and save our country as well. Thank you.
Thank you. Yeah, the government has to do what it can to make sure that at least the healthcare of the country is elevated, because there are those who have the financial muscle to make things happen, travel outside the country and seek health, but those who are not in a position to do that, they end up suffering. So thank you, Mr. Charlo, well said. So Dr. Lorna, your final words and what you would like our audience to take away from this conversation.
Okay. Yes. So you are creating a good chance to discuss about the innovation. So for Zambia, we need to follow with the advanced step from the world of the other advanced country. So we can let all people to have the chance to help from the new technology, from the other country creating. So this is our medical staff, not only the government, the private, and all the resources of the Zambia. It can give more investment for the finance support to the development medical institution. So that will be helpful for all people for more early to have the chance to get the more modern treatment and more advanced medicine. Yeah, so this one can help all the people in Zambia. Thank you.
Yeah, well said. Yeah, we need the new devices, modern equipment and technology, innovation powered by research to be able to position the country with that which it needs to provide the best healthcare for our people. So thank you, gentlemen, for taking time to be on this important conversation, where I greatly appreciate. And then I think we'll circle back at some point where we can look back to this conversation, and as we look forward to where we have come. I believe with the advent of AI, because in these other parts of the world, AI, for instance, I have a little bit of background in HIV because I used to manage the HIV program for the state of Indiana here in the US. In the 80s, HIV used to be a death sentence, but now, I mean, technology and medication has changed all that, especially for people in Zambia who depend on these life-changing medication. So it's all due to research, it's all due to innovation. So we hope there can be a very robust research industry in Zambia that will inform and be able to give birth to new devices, because we don't always have to look to other countries. We have capable people who are capable to bring about some of these things. It's just that the government has to look into these spaces and fund this project so that at least Zambia can be one of those countries which can be known for having a very functional healthcare system which provides the best quality of care to all citizens, so that at least if it were up to me, no one will be allowed to go and seek healthcare outside the country, because that will force the politicians to ensure that the healthcare is functional, because it is a form of discrimination where others are able to travel and others will just die because of being poor. So this is why people elect leaders that are able to bridge these gaps that exist, so that at least healthcare is not a privilege but a human right. So end it at there, gentlemen. Again, I thank you all, and we'll circle back at a later date to discuss and see where the country stands, let's say, in the next 3 to 5 years. Again, thank you, gentlemen.
Thank you.
Thank you.
Thank you. Cheers.
Bye-bye.